Head and neck cancer is a very complicated treatment. It is a complicated area of the body to treat. Everything's in close proximity. You're eating, you're speaking, your salivary glands that make saliva, your breathing tube, so all of these things are in close proximity and can be affected by the treatment. And it's very important to have treatment with people who do it all the time.
Experience is extremely important when dealing with head and neck cancers. Many of the critical structures that we use for talking and for swallowing and for speaking are right next to each other, and they're often right next to areas where the cancer might spread to. So having clinical experience with surgery, having clinical experience with radiation, having a strong clinical experience on knowing what type of chemo doses and medical conditions might not play well with each other, those all play into what your long-term survival and quality of life would be.
We have 3 tools in our armamentarium principally to treat tumors: surgical removal, treatment with radiation therapy, and treatment with chemotherapy. All of those disciplines have worked at a concept similar to minimally invasive surgery at decreasing their side effects of treatment and treating just the tissue that needs to be treated and no other tissue that doesn't need to be treated. In the field of medical oncology, that's come about by using more targeted selective drugs that go just to the tumor cells and not over here to the normal cells. In the field of radiation oncology, it's been able to take advantage of targeted therapy, so you're treating just the boundary of the tumor that might be right here and not the eye that's a millimeter away from it. The way that that's being done is by super focused selective radiotherapy, and then today's world, the leading edge is proton beam therapy. And proton beam is the best radiation therapy right now available to us to stop right at the tumor, deliver all of its dose, and not pass on through to the next space.
We have an excellent surgical group that does surgery for head and neck cancer. And we have a unique surgery here called robotic transoral surgery. Because we have such a long and very strong history with head and neck surgery here, we really built our research around trying to use surgery as a way of decreasing how much treatment people need.
The surgical robot was a relatively new thing 10 or 15 years ago. It wasn't ever designed for my specialty. We were one of the first institutions to use it because I went to our surgical team and our administrators and say, "This looks really promising, can we go out and try it out?" And the next week we were out at the company doing experiments with it. That instrument has turned out to be a huge thing for patients in our field. So the surgical robot allows you to get into tight spaces with what's called minimally invasive surgery. If I have to get in and take care of a tumor of the throat, I've got to get instruments in there in ways that I can see in there in that tight, dark space very efficiently. Historically, we used to make large incisions through the neck. We used to divide the jawbone to spread it apart to get our hands in there. And we figured out with technology, we could work just through a patient's mouth, get the same view, do the same surgery, and get out without having to do big incisions. They could go home tomorrow versus go home in 3 weeks. I wouldn't have been able to develop practice and expertise and knowledge with that instrument if I didn't have an institution that was willing to invest in that technology, because ultimately they knew we would figure out a use for it that would be better for the patient.